I got a text message this morning from a client, and it was with good news. She had gone skiing over the winter break and she didn't have any pain, so everything was good. And the interesting thing is I had been a little bit, not worried, but this person was having left-sided pain in different areas. So she had it in her left foot, she had it in her left hip, left lower back, and then left side of her neck. And the reason I keep saying left is because left-sided pain just tends to be a little bit more stubborn than right-sided pain. And there's two reasons for this. One is that left-sided pain is often due to pathology, and pathology is the sense of, in the way that we talk about it, is that the body has essentially broken the rules of movement to create movement where it couldn't get it. So the basic place that this occurs in pretty much any of the athletic population is in the front of the left hip. So this is the left. When the leg is in the acetabulum, the hip joint, so my arm is the femur, when the pelvis rotates to the right, so the left side rotates forward, which is the classic left AIC pattern, our leg goes with it. So our left leg would be oriented to the right also, but it needs to stay straight, or it needs to get straight. So in order to get straight, which is this way, this is right orientation, this is straight, that right leg has to swivel out. Now this doesn't happen to everybody to such an extreme, but it's going to happen it probably happens to everybody at least a little bit. But when you're trying to get this external range of motion that you can't get because the pelvis is oriented to the right, there's ligaments in this anterior hip capsule area, in the front of the hip capsule, that are supposed to prevent excessive external rotation of that leg. But we have to get it because of this orientation of the pelvis, so that leg has to externally rotate. And when you keep doing it over a course of how many years, and maybe you're athletic and you work out a lot of people will develop laxity in the front of that left hip capsule. And so we would call that pathological. Now that left hip is too loose. It can do things it shouldn't do. You'll often find an excessive left hamstring or a straight leg raise. That could be an indicator of pathology also. It should not really go too far past 90 degrees. If the pelvis is rotated forward. If it's neutral, that's fine. But if it's rotated forward, you shouldn't be able to lay someone on their back and have their left leg go up 90 degrees or past 90 degrees, or really definitely not past 100. 90 degrees is not terrible, but once you see that going past 90 degrees on a pelvis that's rotated forward, that's not a good thing, and that's going to be pathology. So they're not going to have a stable connection with the ground. They'll probably also have a weak anterior hip joint as well. So I just wanted to mention that was one of the reasons that left-sided pain is a little bit harder, because you can have pathology all over the place. It's not just in the hip, it can also be in the cranium, and that's where things really get more difficult. She didn't have that. She did have LASIK eye surgery, which doesn't seem to be a big deal. Some of her tests would change, whether I had the lights on or the lights off. But she said she was fine. So she did about 6 or 7 sessions, and it took some time. She had a really weak left hip, and she felt that. And it was a progression of exercises. Started off on the ground. Then we progressed to upright exercises. We incorporated left peripheral vision. I did not have to work with teeth at all. I didn't have to worry about how her teeth were touching. But it was hard for her to build that strength in that left hip, but she did it, and she went skiing, and she's feeling great. The other reason that left side pain is difficult is because it's often a result of what's going on the other side, which is the right side. So the right side is generally overly active, overly compressed. So if Pelvis comes forward on the left, our weight shifts to the right. And as that happens, that's going to happen in the lower body. But in the rib cage also, the ribs internally rotate on the right side. So here's the right side, ribs internally rotate on the right side, externally rotate on the left side. So again, you have this weakness on the left side between the left pelvis and the left rib cage. They go further apart, so those internal obliques, transverse abdominis, all those support structures for the pelvis and the rib cage, to keep that connection between the left side of the ribs and the left side of the pelvis, they go away. And that's why that left side is so important. The right side over here is really overactive. So you have all these right side muscles that are tight, intercostals, your right abdominals, right diaphragm is being overused. So you have to be able to decompress the right side and get them over to the left side. But sometimes compression, or sometimes people have reasons that their body will not let them get off the right side to the left. And a lot of times those are vision, tooth-driven, neck issues, or feet. And so you have to, we had to get her better shoes. That was a big thing. Her tests would change depending on whether she had a little bit extra arch in her right shoe. So that extra arch in her right shoe, it was just paper towels basically. I put some paper towels underneath her right arch. At that point, her tests would change, and that meant that she was being pushed over to the left side. Sometimes if your brain doesn't feel that right arch in the shoe, or basically the ground coming up to the right arch, it won't allow you to pronate the foot. It stays supinated, so this would be a supinated foot. So here's the middle of my foot, here's the outside of the foot. It would stay supinated, and it keeps you over to the right side. If a foot is supinated, it's going to keep you over to that right side. So it has to come down into pronation in order to push you to the left. If it doesn't sense the floor, which is the paper towels underneath the right arch, you will not pronate properly, and you will not push off to the left properly, and your right side won't decompress. So that's another reason why left side pain can be so stubborn, because someone might have a systemic issue, vision, teeth, or feet being the three main ones, that are keeping them tied to the right side, and now the left side is getting stressed out because it's constantly being pulled to the right. So either way, it worked out really well because she went skiing and she had no pain, and she's thrilled.